Imagine waking up to a nation on pause. Federal workers scrambling without pay, essential services teetering, and millions of Americans facing skyrocketing health costs, all because politicians can't agree on a budget. That's the stark reality of a potential government shutdown looming just hours away. But here's where it gets controversial. Is this a necessary standoff over policy, or a reckless game of political chicken? Stick around as we break down the latest updates, and you might just see why this drama has everyone talking. Just 19 minutes ago, the Congressional Budget Office, CBO, that's the nonpartisan agency that analyzes government spending, released eye-opening estimates about what a shutdown could mean. They predict around 750,000 federal employees might be sent home without pay, a process called furloughing, where workers are temporarily laid off but promised back pay once funding resumes. The daily cost of compensating these folks, a whopping $400 million. For beginners, think of it like hitting pause on a massive workforce. These employees can't work, but they'll get paid retroactively to avoid unfairness. The CBO's letter to Senator Joni Ernst, a Republican from Iowa who asked for these figures, notes that the exact number could fluctuate day by day. Some agencies might furlough more people if the shutdown drags on, while others could recall initially furloughed staff. And this is the part most people miss. The shutdown's impact hinges on how long it lasts and what choices the administration makes, like using funds from the One Big Beautiful Bill Act to keep key operations running at places like the Defense Department, Treasury, Homeland Security, and the Office of Management and Budget. The CBO also warns that a prolonged shutdown could lead to permanent economic losses, citing the 2018-2019 shutdown that cost about $3 billion overall. It's a reminder that while furloughs are temporary, the ripple effects on the economy can be lasting. 32 minutes ago, tensions flared in the House during a brief pro forma session, a short, mostly empty meeting held when Congress is on recess. Representative Rosa DeLauro, the top Democrat on the House Appropriations Committee, tried to get unanimous consent to pass the Democrats' alternative funding bill to dodge the shutdown. But the presiding Republican, Representative Morgan Griffith from Virginia, shut her down and ended the session abruptly. Democrats erupted in protests, shouting "Shame on you" and "Do your job." These pro forma sessions are typically quick and low-key, but this one highlighted the partisan divide. The Democrats' proposal, which hasn't passed the House or Senate, aims to fund the government through October 31st. Permanently extend enhanced tax credits for health insurance under the Affordable Care Act, ACA. Reverse Medicaid cuts from the Big Beautiful Bill passed earlier this year, and restore funding for public radio and TV stations that was slashed in a recent rescissions package. But here's where it gets controversial. Republicans argue this is a partisan wish list, while Democrats see it as protecting everyday Americans. What do you think? Should healthcare be a non-negotiable in funding talks? At 11:32 a.m., let's dive into why those ACA tax credits are the elephant in the room for this shutdown. A potential shutdown tomorrow could hinge on extending a subsidy that helps about 22 million Americans afford health insurance to ACA marketplaces. Known as the Enhanced Premium Tax Credit, this financial aid has been a lifeline for low- and middle-income families since the American Rescue Plan Act of 2021. Thanks to it, ACA marketplace enrollments have nearly doubled, according to the health policy experts at KFF, but it's set to vanish at the end of 2025, and Democrats are tying any funding deal to its extension. Experts warn that without it, millions could face higher premiums starting in January 2026. Insurers are already gearing up to send out notices. Alex Jaquez from the Groundwork Collaborative, a progressive economic group and former Biden administration official, highlighted this on a recent call, emphasizing the potential financial strain. For a real-world example, Imagine a family of 4 earning $50,000 a year. Without the credit, their monthly premiums could jump from $200 to $600, making coverage unaffordable. And this is the part most people miss. While negotiations in DC hang in the balance, the human cost is already looming. Read more on this critical issue here. https://www.cbsnews.com/government shutdown Affordable Care Act, Enhanced Premium Tax Credit. 11:25 a.m. brought Senator Dick Durbin's blunt assessment of a missed White House meeting. The Illinois Democrat, Senate Minority Whip, called Monday's gathering with legislative leaders and the president an opportunity that was missed. He described it as a chance to prevent the shutdown, but no follow-up happened. Durbin, who supported a funding measure in March, said he wouldn't do the same now. When asked about future meetings, Senate Minority Leader Chuck Schumer told him none are planned, but Durbin insisted there should be. He labeled a shutdown unfair for federal workers and urged immediate action to avoid it. This highlights the frustration on the Democratic side. Do you agree that more dialogue could prevent this crisis? At 11:09 a.m., Senator John Thune, the Senate Majority Leader, outlined what happens if the shutdown hits. If it does, the Senate will pause for Yom Kippur, the Jewish holiday starting Wednesday evening and ending Thursday. But Thune expects more votes afterward to reopen government operations. It's a glimpse into how even holidays can't halt the legislative grind. 11:07 a.m. saw a heated exchange on the Senate floor between Majority Leader John Thune and Minority Leader Chuck Schumer. Thune challenged Democrats to choose: shut down the government and face the fallout, or support a clean, bipartisan, short-term funding bill. He referenced past quotes from Democrats about shutdown harms and urged them to act for Americans. Schumer, borrowing Thune's chart showing Democrats' support for previous Biden-era funding extensions, agreed with the data but argued the context differs. He claimed those were negotiated bipartisanly, unlike this partisan bill where Republicans didn't seek input. Schumer insisted appropriations need bipartisanship and reiterated demands for extending healthcare credits and limiting the president's rescission powers. Thune defended the process, noting the November 21st extension date was agreed upon by House and Senate appropriators from both parties. He offered to discuss the ACA credits later and emphasize the bill's short-term nature. As Thune left, Schumer reclaimed the floor. But here's where it gets controversial. Is this truly bipartisan, or just a Republican push? Thune's clean bill versus Schumer's partisan label. Where do you stand? 10:58 a.m. The Department of Housing and Urban Development's website now features a bold red banner blaming the shutdown on Democrats. It reads, "The radical left are going to shut down the government and inflict massive pain on the American people unless they get their $1.5 trillion wish list of demands." The Trump administration wants to keep the government open for the American people. This provocative messaging amps up the political rhetoric. Do you see it as rallying the base or crossing into divisive territory? 10:44 a.m. Without a last-minute agreement, at least 494,879 federal employees face furlough starting Wednesday, per CBS News' analysis of agency plans. Another 1.4 million will be accepted, meaning they must work despite the shutdown, and both groups risk delayed paychecks, though back pay follows. The Office of Management and Budget requires agencies to post plans, but many haven't updated them. Of the 15 cabinet departments, 10 have shared details. Others rely on old plans. Key figures include the Defense Department. Civilians, 741,477 total, 334,904 furloughed, 406,573 retained. And Veterans Affairs, 461,499 total, 14,874 furloughed, 446,625 retained. Full breakdowns for Homeland Security, Justice, Health and Human Services, IRS, Social Security, Commerce, State, NASA, Labor, Treasury, Education, and Office of Personnel Management are linked in the original reports. And this is the part most people miss. These numbers show how uneven the impact is, with some agencies barely affected while others grind to a halt. 10:36 a.m. House Minority Leader Hakeem Jeffries, surrounded by Democrats on Capitol steps, vowed to fight on. "We are in this fight until we win this fight for the people," he declared, focusing on healthcare. He warned that without extending ACA credits, millions will see premium hikes soon. Jeffries called for canceling cuts, lowering costs, and saving healthcare. While open to bipartisanship, he rejected the Republican bill as partisan and harmful. He also slammed Trump's recent video as racist and fake AI, challenging him to say it in person. This stance underscores Democrats' resolve, controversial or principled. 10:20 a.m. President Trump revived his idea of Canada joining the U.S. as the 51st state, claiming they called wanting in, partly due to his tariffs. Canadian PM Mark Carney has firmly rejected this, saying Canada is not for sale. Trump's reciprocal 35% tariffs on Canadian goods add fuel. Do you think this is diplomatic banter or a serious proposal? 10:08 a.m. Senator Richard Blumenthal called the shutdown a self-inflicted, totally unnecessary, avoidable wound by Trump, citing his fake video as proof of no intent to compromise. He saw it as despicable AI use and a sign of Trump's desire for mockery and vengeance. This, he said, disgraces the nation. Agree or disagree. 9:40 a.m. A shutdown affects the military uniquely. Active duty troops and deployed National Guard continue duties with delayed pay, while essential civilians work on. Non-essential civilians are furloughed. Back pay applies via the 2019 Act, but military pay needs separate legislation, like the 2013 Pay Our Military Act. Seamus Daniels from CSIS explains it's designed to keep defense strong. Read more here, cbsnews.com/news/government shutdown impact U.S. military. 9:34 a.m. Trump hinted at mass layoffs. "We may do a lot, and that's only because of the Democrats." The OMB memo urges agencies to consider reduction in force notices for discretionary funded roles, beyond furloughs. This could shrink the workforce permanently. Controversial efficiency or overreach. 9:05 a.m. House Speaker Mike Johnson expressed skepticism about avoiding shutdown, blaming Schumer and Jeffries. He called Democrats' strategy reckless, aimed at appeasing their base rather than governing. He sees no reason to oppose the CR. Updated. Senate votes on House bill to fund until November 21. Needs Democratic support. Democrats' proposal failed earlier. Thune says it's up to them. Updated. Trump posted a fake AI video mocking Schumer and Jeffries with racist stereotypes. Jeffries called it disgusting. Schumer retorted, "It's a tantrum." White House hasn't commented. Past fates include Powell cartoons. But here's where it gets controversial. Is this humor or harmful propaganda? What are your thoughts? Does this escalate tensions or just highlight the divide? Share in the comments. Should politicians prioritize healthcare extensions over short-term funding? Or is the GOP's approach more pragmatic? Do Trump's actions signal a shutdown is inevitable? Or could cooler heads prevail? We'd love to hear your take.